And some breaking news coming in at this point in time. This is with regard to the vaccine drive, the second phase of the vaccine drive. Union Health Secretary and Chairman Empowered Group on Vaccine Administration, the chair met on this entire strategy for phase 2. States and UTs were explained the basic features of the CoWIN 2.0 app. All of those details were discussed in this particular meeting with the states. The process of the advanced self-registration, on-site registration, all of that was explained as well to the states. Those are the latest details coming in at this point in time. All of this, of course, as very important, considering the fact that the second phase of the vaccine drive is all set to begin now from the 1st of March. So states and UTs have to be completely familiar with how all of this is going to work, what are the features of the CoWIN app, and how exactly it has to be carried out. So all of those important points that has been explained to the states and the union territories. Ayushman joining us for more details. Ayushman, obviously this is an extremely crucial meeting because we've seen in the first phase how there were a lot of glitches in the CoWIN app. So it's extremely important now, as the second phase of the drive begins, that all states and union territories understand how everything works.
Yes, in fact, the states and union territories have been once again explained the modalities of the CoWIN 2.0, because this is 1.0 which is being currently used. In this, three methods are there. One is advanced self-registration, in which the beneficiary will be able to register themselves. And then through IT application, Arogya Setu, there is on-site registration facility which allows them. One cannot self-register, then one goes to the vaccination center and get themselves registered and then vaccinate. Now, third and the most important is facilitated cohort registration. In this mechanism, the state government has to take the proactive lead. In case the numbers are not high, the state government health authorities will ensure that the target group will be vaccinated through ASHA, ANMs and Panchayati Raj representatives will be utilized for mobilizing to target those groups. So the slow pace of vaccination, which we have seen in the healthcare workers and frontline workers, in this time, if this happens with the 60-plus group, the states have been told that you can target that population through the health machinery that you have, and then targeted vaccination can be carried out.
Yes, absolutely, Ayushman. And those are some important details that are being discussed right now. But while we have you with us, let's just talk about, what exactly is going to be the process now going forward. We also know that during the weekend, there's going to be no vaccination that's going to be, taking place to prepare for the second phase, which is beginning on the 1st.
Well, if you see currently the situation is that the CoWIN app is currently catering to the two priority groups, which is one of the healthcare workers, the other of the frontline workers. Now, this is about a population of about 3 crores. The second priority group, which is of above 45 years age in comorbid condition, and 60 years above age is the mandatory group. Now, in that, somewhere about 12 crore to 15 crore, we are being told, is the number of beneficiaries that the government is targeting. So this is a huge number, almost 5 times more than what it was in the first phase. So to upgrade the application in the 2 days, the application will be shifting on a newer and an advanced version. So for that reason only, these 2 days, no vaccination will be taking place.
Yes, absolutely, Ayushman. And also some more important information coming in now at this point in time. There are 3 main methods of getting registered. So the first option is getting registered via the CoWIN 2.0 app. The second option is on-site registration. And the third option is facilitated registration as well. Ayushman, if you can break this down for us, what it means and what is the, how people can actually go ahead and get registered.
Well, like I said, the first one is through the application, and if one has the application, one can go and get themselves registered through the applications which are there, and that is not just the CoWIN app, it can also be done through the website and also through the Arogya Setu. Now, the second, that is the on-site registration. One can go with the documents, can get themselves vaccinated on the spot. So if a hospital is there in your area, you can go to that place, provided that you are above 45 years and below 60 years in comorbid condition. If you are above 60 years, you are going to be needing the document only of age verification. And third is when the government intervenes, when the numbers are not
Right.
high, it knows that this is the population that they have to vaccinate, and then they can act upon.
All right, Ayushman, thank you so much for joining us with all of those details.